That's why I wanted to get it clear.
Okay. Okay, ladies, we're calling to order. So we're gonna go ahead and get our foundation meeting started. We're gonna call to order at 6:39. Roll call, please. Director Smith. Here. Rogers.
Here.
Director PerezGil. Here. Director Logsdon.
Here.
Secretary Lara. Here. President Barraza.
Here. Thank you. Next item is B, approval of the agenda.
I make the motion to approve.
All those in favor say aye. In opposition? C, public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Do we have any public comments?
No public comment.
Thank you. Next item is D, consent agenda.
Make the motion to approve.
Second.
Roll call.
Director Smith.
Yes.
Director Rogers.
Yes.
Director PerezGil. Yes. Director Logsdon.
Yes.
Secretary Lara.
Yes.
President Barraza.
Yes. Thank you. E, reports. E1, mobile medical clinics campaign and initiatives.
Yes. So with DPMG Health, our partnership continues. So in June, as you can see there, we hosted quite a bit of clinics. I did a couple of homeless clinics. Sports physicals were our big draw in June and in May as well. One of the things that I do want to point out is that, through Donna's conversation with some folks on the Greater Palm Springs Animal Allies, we were able to now have animal services or dog services at our DHS homeless clinic that we do every month there. So they were able to provide vaccines, microchips, dog leashes, and dog food, wet and dry, free of charge to 60 dogs we saw that morning. And 41 of them were from Desert Hot Springs, and 10 of those dogs were from homeless individuals. So that was a good, I was just, talking with Councilmember Pai about the hook that, the strategy that went behind that we would drive up. We do rent a vehicle to go pick up the unhoused from their different encampments. And some of them did have dogs and, they declined services for themselves, but then as soon as we told them, we also have services for your pets. And they said, oh, really? So some of them have their own kennels. We had a couple of kennels from GPSAA that they let us borrow. So we were able to bring dogs and the unhoused person into our clinic. So the individuals will get seen by our doctors. They got a haircut, they got a shower, they got clean socks and underwear, and then their pets were taken care of. And as soon as we were done, we drove them back to their encampment. So it was a wonderful, wonderful partnership. We want to continue to grow that partnership there and hopefully maybe even expand it to other locations throughout the Coachella Valley. So just wanted to point out that one great outcome that we had from that partnership with the Greater Palm Springs Animal Allies. And there in the packet, you can see May 2026 recap. We did 3 vision clinics, 6 general medical clinics. We did 6 sports physicals where we provided physicals to over 1,000 student athletes at 8 out of the 10 high schools here locally. So we service all of the high schools with the exception of Rancho Mirage and Palm Springs High School. Because there's a parent that's a physician, so they kind of handle that for those teams. But really happy with our outcomes that we continue to see with our partnership with DPMG Health.
Any questions or comments on this item?
Enthusiastic about all the work that you all are doing. So thank you for updating on that, and particularly the homeless clinics. And I think, because I see we have some later dates in the month, but I know that I would be interested in participating in some of those at some point, and maybe other board members as well. So if when you have dates and things picked out, if you don't mind emailing those to us. Because I think it's a good opportunity to really engage with folks and see you all, at work. And I know President Barraza has attended a number of events. Question, with the heat now, are you all providing more water, different types of things to address those needs that come up when you have extreme heat, now that we're kind of getting into it? Do you have a need for more water? What does that look like now?
Through some of the locations that we have, they do a fine food distribution, by food bag food distribution. So some of these unhoused people, they walk out with gallons of water, opposed to the individual water bottles. We found that it was more effective for them to take it back to the encampment and be able to have a whole gallon versus a handful of waters. We could always use more donations of water. One of the things that we typically like to buy during the summertime are liquid IVs, or the liquid IVs. So that the packet, so they could just put them in their water so they could continue to hydrate themselves. We also have purchased in the past, and if there's still funds remaining in the homelessness fund, we also buy like sunscreen for them, like in the individual packets, and we create little care packages for them. This month, we were able to provide women goodie bags, so with some feminine hygiene products in there that came from one of the unhoused women that let us know, like, hey, we also deal with these additional issues that we don't have resources for. So we were able to buy cases of tampons, maxi pads, towelettes, that we put in little bags that we distribute to the unhoused women. So we're able to address some of those different needs as when it gets hot, we try to provide, like I said, the liquid IVs, the sunscreen. And when it gets cold, we do like sweaters, beanies, things like that. We've done in the past. So we try to address some of those needs.
Do you also give them resources for the cooling centers?
We do. We also do provide them information of where they're located, so they know exactly where to go. And typically, we do have the Riverside County Department of Social Services mobile unit out there with us. So they're handing out some of the information of where the locations are.
Do we transport folks?
We do.
Okay.
Oh,
To the cooling centers.
we don't. We don't. We just pick them up from the encampments, bring them over to the location, and we only do that in Desert Hot Springs. Because that has, obviously, it's a really remote area, and they're deep into the desert. Funny story. Last month we actually had to get towed out because we got stuck in soft sand because we went really deep into the desert. So now moving forward, we rent 4x4 vehicles, so we'll be covered. But we try to transport them because it makes it easy for them. They and the partnership that we have with First Baptist Community Church and also Word of Life Church, they do a brown bag food distribution every Tuesday. So those folks are the ones that ride with us. Either Sergio or myself will ride or would drive the vehicle, and that trusted messenger, that trusted face, is the one that goes out to the folks because they know them. They see them on a weekly basis. They know where to go. So we're pretty much just driving, and they're the ones that say, go here, go there. There's 20 people here. There's 10 people there. We go, and some of the locations are just, it's very, very eye-opening to see some of the living conditions of some of these folks. It's, they're very resourceful, but it's just really unfortunate in some of the locations that they're living.
I have a
Pretty briefly, it'd be great if we could get some of these dates on board members' calendars. I know that we do get a list and the flyers, but it'd be good if we have them on the calendars in case we're, out and about and, hey, there's going to be a clinic, or so that we can schedule them or work on them. Director Rogers?
Thank you. As always, I think that Alejandro's efforts in community engagement is probably some of the most important work that our district does. I wanted to invite you all to the first Tuesday at 10 o'clock to the Word of Life Church to help assemble 120 lunch bags, and we all go out in our separate cars and hand them out to the homeless people in our community. Alejandro didn't mention that the food bank provides us with, I don't know, tons and tons, pallets and pallets of food that's handed out to people in the community. And they can just come in and grab a box and fill it up. Excuse me. And also, Mission Springs Water District has offered us a pallet of bottled water to hand out to homeless people. Our problem is that we need someplace to store it in a controlled environment. So if anybody has access to a storage unit where we could put it there for the summer for the free clinic and for the program that Alejandro described, that would be very much appreciated. Maybe the CEO discretionary fund might pay for that. Just a suggestion. Thank you.
Any other comments or questions on this item?
Okay, so the second one, and Andrea, if you could pull up the vision, yes. So in our partnership with Lestonnac Free Clinic, as you know, most of you know, we contracted with Lestonnac Free Clinic. That is a free clinic that's based out of Orange County, but they service Orange County, San Bernardino County, and Riverside County. I met the CEO at an event that they were doing out in Our Lady of Guadalupe in Mecca, and we contracted with them to do 12 mobile vision clinics. As you can see, we've hosted them throughout the Coachella Valley, and very purposely so. We did 4 events in the East Valley, 4 events in the Mid Valley, and 4 events in the West Valley to ensure that we had equitable access for all community residents, you know, depending on where they were living. To date, not including the June 11th clinic, we have done 568 vision screenings. We have cut on-site 455 distance glasses. 257 readers have been dispensed, and 82 individuals were referred to the Lestonnac Free Clinic in San Bernardino for eye exams, because, you know, through the eye screening, they detect some kind of issues with the eye, so they refer them for further testing at their San Bernardino clinic. The next one that we have is at Jóvenes AA Recovery Home in Sky Valley, and that's this Saturday from 10 to 4, and that will be our last one that we have contracted out with Lestonnac Free Clinic. We are working on an extension for another 12 events that we would bring to the board possibly in July, so we could continue the services with Lestonnac, but really good outcomes. I know we had President Barraza show up this last Thursday where we had, and also Director de Lara. And if you guys would like to share a little bit about your experience, what you saw, the process, what it all entailed.
Well, thank you for calling me over to give me an opportunity to see firsthand the way the operation was handled. It was very, very smooth. And I love the technology that is being used. The one thing that was a drawback, of course, had to do with the generator. But I'm glad that you are looking at ways to address that in the future. So thank you for inviting me. I do have a question. You mentioned that some of the persons that are receiving glasses sometimes get referrals to the San Bernardino clinic.
Yes, that's where the Lestonnac has a free clinic where they have ophthalmologists that they could actually dilate the eye and look further beyond what the capacity of the current equipment that they have for the eye screening. So some individuals, when they go to the eye screening, they detect some kind of issue that, and they refer the individual for further testing out in their San Bernardino clinic. We are trying to work with them to bring that service hopefully closer. But those are conversations that we're having with Lestonnac. You know, to date, as you can see, maybe some of the data here, some of the folks, over more than half of them have never had, or it has been more than 2 years since they actually have received some kind of eye screening, which is alarming. Further down, if Andrea, you could scroll down to the next data set. You know, if the mobile vision mobile unit was not here today, how likely would he have gone an eye exam this year? You can see the different breakdowns there. And then the next one on the right, how far did you travel? So over half of the people that came to the vision clinics travel more than 5 miles to come and get their eyes checked out. It's a,
Alejandro, going back to my question about, how many people, what happens at, the clinic, the follow-up clinic. I'm concerned because the data shows that a lot of people will put this as a low priority or not even address it if it's not convenient, if it's not costly, financially feasible. So it's very unlikely that a lot of people will actually, and I'm speaking generally, but that will actually go to San Bernardino and do the follow-up. Having from firsthand experience, my husband has to go to Loma Linda, and it's a challenge to have to do this. So I hope that you're able to address this sooner rather than later. And also keep track of the ones that were referred and that do not get this follow-up, so that they're at top of our list, that when you do have this opportunity that is closer, that they have an opportunity that may actually be more feasible and accessible.
yeah, one of the things that we have been discussing with Lestonnac Free Clinic for the next round to address that issue is, and I used to do it when I worked for the nonprofit, and we used to work with the Southern California College of Optometry in Fullerton, where we rented a 12-passenger van and we would transport people directly ourselves, and they would clear out a whole afternoon of appointments, and they knew that these people were coming that needed to see the optometrist. So that is one of the ways that we're trying to address the issue, is instead of having them drive themselves, because we know transportation, through all the different surveys, all the different community forums that we've had, transportation continues to be the #1 barrier for access to care for low-income individuals. So what we're trying to do now is, rent this 12-passenger van, obviously, get waivers and all of that, all the legal things, so we're not held liable for anything if something were to happen, but transport them out there ourselves and have some kind of sequence on a monthly basis that every first Saturday of the month, we transport those people and they clear out an afternoon for us with appointments out in San Bernardino. So those are the discussions that we're having to address some of those issues.
Thank you. And hopefully that's just a temporary thing until we actually do something here local. Thank
Working
you.
on
Fernando.
Thank you. And for me, I think it was a great experience just seeing the flow of it, how coordinated it is. You mentioned it wasn't just walk-ins, people had made appointments. The fact that, it was, I believe this one was for adults, but there were some children present. Knowing that you can go and get your eyes checked, a new pair of glasses, and out there, be in having, to wear glasses myself, right? I know what that feels when you can, or when you've actually, a leg breaks off and you can't get it replaced and you're holding it or taping it together. So I think it was very rewarding seeing how what we've been able to do here within the district, or staff has been able to do as well, is, it's actually, that there's a need and it's directly being addressed by our programs. So I'm happy on how that went, being able to be here in person, and then also looking forward on the possibilities for the healthcare district, right? To not only partner up with them, but see how greater impact we can do as a whole within the entire Coachella Valley. So thank you for that. Any comments or questions?
I had a comment.
Director Rogers.
Yes, just a suggestion. I know that in the past, we have obtained free bus passes for people, and maybe that's something we can provide for these clinics.
Talk to Mona. It's good to see you. Free bus pass, we serve it. And the other thing that I want to point out is that, through Megan's leadership and, taking on this project of submitting abstracts to 3 different conferences, we have been approved for a poster session at the American Public Health Association. And we just received notification last week that at the Mobile Healthcare Association, they have selected us to do a breakout session as under the Vision Specialty Group, which is a 15-minute to 20-minute presentation with a Q&A with folks that want to learn about this type of process, the vision mobile units, and how do we actually do this out in the community. So Once again, I just want to acknowledge that Megan put in a lot of work. She did really, really great work that I provided the context, the data, and then she makes this, beautiful posters and really eye-catching data sets to ensure that as you walk up, you know exactly what's happening. The data flows very well. The language is very concise and to the point and acknowledges our partnerships and the impact that we're making out in the community.
Next item.
Next one is the Pink Journey Foundation. Once again, we had really great results. Part of the Women Wellness Clinic, we also have a survey. So we are collecting data from all of our specialty clinics that we're doing from the Vision and also the Women's Wellness Clinic. Here, how overall would you rate the experience of the clinic? 94% of all the attendees had said excellent. So for us, it's a really, really great, mechanism to, capture, what people are experiencing. And we heard from Leti, or Director de Lara, from one of her, staff members that participated in this, and she loved the experience. Maybe we could scroll down just a tad bit, Andrea, to the next one. What services did you receive? 147 of them said mammograms, 118 of them said pap smears. How would you rate the helpfulness and support staff of the clinic staff? 206 said very helpful, 98%. Scroll down just a bit more. Did you encounter any difficulties during your visit? Just 94% no difficulties. After your visit, did you feel more knowledgeable of breast health and the importance of regular mammograms? 79% said yes, very informed, because we do provide them a little informational packet. We provide like a little goodie bag with some educational materials, and also the Pink Journey staff walk them through the whole process and how they do a breast health exam beyond the mammogram that they received that day. Scrolling down a little bit more. And then after your visit, did you feel more knowledgeable about the importance of a regular pap smear screening? 76 said yes. 7% on question number 7, would you recommend this clinic to others in your community? 100% of them said yes. Yeah. And then here, one of the things that I want to kind of point out is some of the things that we do. We have a text through our appointment software that we use to make appointments for our specialty clinics, because we don't allow walk-ins, or very few walk-ins. We actually have the capacity to send out reminder text messages to those folks that have appointments. And we have a cadence of sending a text message the day before and an hour before their appointment. So we constantly remind them. And the first, comment there says, the medical staff and the follow-up correspondence and the text messages were, amazing. And if we scroll down just a little bit more on those comments, Andrea, you know what, it's a PDF, I'm sorry. But, some of them are, saying that this is an important service for uninsured women. We get a lot of uninsured women, and in my staff report, you can see the breakdown of all the different, the number of screenings that we have provided, the women that have a follow-up screening. So they detected some kind of abnormal test result. So 11% on the mammogram side and 14% on the pap smear side. And on the uninsured status or insurance status of individuals, we have 40% of the women that come to our clinics are uninsured. The last thing that I want to point out is a personal story of one of our patients, Sandra. Sandra was one of the women that was going to get interviewed at our taping of the Women's Wellness Clinic that we'll put together. Unfortunately, she fell ill. She was going through chemo, so she didn't feel good that morning. She said, you know what, I cannot attend. Great. 3 weeks later, we got the great news that she's cancer-free. At 3 a.m. the next day, she got a call from the hospital that her husband passed away. Her husband was the sole breadwinner of the family, and she was just lost. Thankfully for Sergio, he is amazing, and he has heard it multiple times from multiple women that he is their angel. He connected them with Fine Food Bank, with different resources. Myself and Sergio contributed some money for her to at least get some groceries, get some gas. And for us, this is the stories that we see every single clinic that we do. From the single mom saying, I cannot pay the copay for 4 of my children that are going to play sports because it's $30 each. So that's $120 I could not afford at this time. So I'm not going to, if it wasn't for your sports clinic, my children would not be able to play sports this year. To the parent that brings their child in to get a Tdap vaccination that says, hey, my child is going to get kicked out of school because they're not compliant with the California Department of Education vaccination standards. Those are the people that we're seeing. They're not numbers on spreadsheets. They're not, on staff reports. These are the people that we serve every single time our mobile units are deployed. And these are the stories that we hear. And as you can see, we take it very personal because we don't just see them just one time. Sergio has gone to multiple people's houses to help them fill out applications for the Desert Cancer Foundation, for the Pendleton Foundation to receive additional funding. And I wish that we as a district had some kind of fund that we could help these women, these individuals, when they come to these very, difficult periods in their life. Because poor Sandra is just sitting there now trying to figure out what is she going to do. Her husband just passed away. She has to make, instead of being a celebratory moment for her because she was cancer-free, the next day she has to worry about how am I going to bury my husband. So for us, this is a very important, role that we take on because we're the face. We interact with these people all the time. And we have hundreds of stories that we can share with the board, hundreds of testimonials of individuals that come to our clinics and say, thank you, because I couldn't afford the copay. I couldn't make an appointment with my physician. We have literally saving lives because of the resources that we are dedicating to these mobile clinics. So just wanted to share that personal story of Sandra. Thank you.
Thank you. If I may, that's good. Alejandro, I just want to say thank you for you and Sergio and all your team for the work that you're doing. You are the ones that come in contact with a lot of the people that we're hoping to be able to help. And unfortunately, we're seeing more and more families trying to call into this group. And so this is what we are facing. We're going to continue to see the numbers increase. So this is something we have to prepare for. And as you're sharing this testimonial, I'm thinking we have the Pendleton Foundation, we have Desert Cancer, we have these nonprofits that are there to support us, and they do tremendous work. They have the face-to-face, just like the Galilee Centers, the City Rescue Mission, all of these organizations that are doing that work. And when I was mouthing to Donna, social justice, the social
Services.
social services.
That's funded 2 cancer centers, yes.
So that's how we, a tiny bit of how we can support them, but really using the networks of the nonprofits that are doing the work. And I know that it's something that that we are challenged with what we talked about at the previous meeting, the finances, the strategic plan and all this, but it doesn't mean that we don't support them. It just means that we have to work together to figure out how to make the resources we have the most impactful. And sometimes just the resources of sharing what you were saying right now, just knowing who to call. I know that I did that in my previous role all the time, is calling on the people that I knew to help. And so I thank you for caring enough to do that, to pick up the phone and to make those connections. So thank you for everything you're doing.
Other comments? Questions?
I have a comment.
Go ahead.
Thank you. I just want to suggest that perhaps maybe a staff discussionary fund might be appropriate. I know that we have community partners that, like the Cancer Fund that we support but the staff, because they have first line responders, so to speak, might be able to be able to be of more assistance in a timely manner. I have one instance where the CEO discretionary fund helped with the airfare of a homeless man who had a recent amputation, was in a wheelchair, and the team at Word of Life Church was able to purchase a airline ticket to get him home to his mother in Florida. And those are the kinds of things that we don't hear about, but because we raised funds among ourselves, but the CEO discretionary fund paid for the final, I think it was $300, get this person home to be taken care of. Those are the kinds of things that are needed on an emergency basis.
Any other comments? First and foremost, our condolences to Sandra, her family. And I really do appreciate you, the sincerity in your report. And please don't ever stop sharing these cases with the board, because as you heard today, right, like there's options, there's opportunities for us to, go the extra mile. And I think for us, especially, well, for me, listening to these stories, that's when it gives us, that visualization that it's not just numbers, it's just not another clinic, it's not just another person, right? It's actually like we're changing lives, we're helping people out. And I think that that's great for the healthcare district, especially, right? It's not just about the programs or at the large scale, the presence and impact that we're making, but it's also on the individuals. And I love hearing these stories. And so thank you. Please continue sharing them. And I hope that we can move, in a direction where we could be more supportive within these similar cases. Okay. Thank you. So now, next up is F committee meetings, finance and legal.
Draft meeting minutes are available from June 9th. Quick meeting, no real updates from that.
Any questions? No. F2 program committee.
The draft meeting minutes are available in the packet if anyone has any questions. And the grant payment schedules were also provided in the packet. Does anyone have any questions regarding the information?
Any board member comments before we adjourn? Go ahead.
I had the opportunity to attend the Operation Splash annual event, the kickoff on June the 6th on behalf of the district. I was there along with the City of Coachella representatives and Kaiser Permanente. They presented a check for $42,500. And there was a parent that approached me afterwards, and she told me that she had went online. She was waiting to get online, and that they make available 300 passes for families, and that as soon as she logged on, it immediately said they're all gone. And she has she shared with me that her son is autistic, and that she was there, and that she was hoping to talk to the ERD general manager, and she did. And she was just voicing her dilemma of the fact that this is starting to become even more of a problem, because Coachella is a growing city. It's a very young city in terms of population. There's a need to have more kids being able to swim for safety purposes, for health purposes. And so I was surprised and disappointed that happened. I know in the past the district used to partner with them on this, and Alejandro and I used to actually attend this kickoff. I think that's why you were smiling, because now I do it by myself. But if there's something that we can just explore, because I do think that it's so important, and I wanted to share that with you. Thank you, Andrea, for sharing the invitation and giving me the opportunity to be there on behalf of the district. It's just something that I would like you taking it back to see if there's something that we could do to support that program, because for it to be immediately unavailable within minutes is definitely a concern.
It's a very popular program. And they still use our branding from Ready, Set, Swim Junior. That's our logo, that's the curriculum that we, co-developed with the Desert Recreation District, and we had Ready, Set, Swim, and then Ready, Set, Swim Junior for children under the age of 5. And that was, I love that program. That was wonderful. The third graders from all school district learning how to swim.
Maybe if we can start it again or start focusing on the Ready, Set, Swim, since it seems to be something that is needed in the community, and I think it goes with one of our pillars for more classes and more education.
Give me the direction and the money and we'll make it happen.
Okay.
All right. Any other board member comments?
One more comment. I have a question for Alejandro. How much is one serving of vegetables?
The hand.
This is a question that one of his students asked him.
Oh, how cute.
I used to do the Ready, Set, Swim program. It was 2 hours, 1 hour swimming lessons, 1 hour nutrition education.
And one serving, he held up his hand and showed them.
Well, thank you, everyone. Meeting adjourned. 7:16.
Just checking all this.